So today in this video, I'm going to be talking about the paternalistic, interpretive, and deliberative models and how they apply to Mr. and Mrs. Lamb's situation and how she is having increasing Alzheimer's conditions and how Mr. Lamb struggles to care for her because his COPD is causing him to be on oxygen. So the scenario is, I kind of did a brief summary of it already, but Mr. and Mrs. Lamb have been married for 60 years and are very close. It has become apparent that Mrs. Lamb struggles more and more with her diagnosis of Alzheimer's, and she no longer can be left alone. So Mr. Lamb has been recently put on oxygen due to his COPD, as I have already said. And I'm playing the doctor in this situation, and I have recommended that Mrs. Lamb be sent to a skilled nursing facility, but Mr. Lamb refuses as he wants to take care of her on his own. We're just going to see how we, as a provider, how I would use the paternalistic model to care for them and advise them throughout their healthcare journey with Mrs. Lamb's Alzheimer's and how to push them in the right direction to get the best care possible, but also have them be happy. And also with the interpretive and deliberative models. So the paternalistic model is the traditional model in which the provider is viewed as an expert authority on healthcare, and the provider plays a role of a parent or guardian, and the patient assents to the provider's authority. So pretty much like in this model, it's like the more old school one where the provider pretty much like tells you what you're going to do and you don't really have much say because you just believe what they say is the best option. So if I'm going to apply this scenario or this model to Mr. and Mrs. Lamb's scenario, I would spend little time sympathizing with Mr. and Mrs. Lamb in their situation and really push for Mrs. Lamb to be moved to a skilled nursing facility. And I would really emphasize the fact to them that I have the most knowledge on healthcare and how to like cure diseases and make sure that people can live as long as possible. And I would hope that Mr. and Mrs. Lamb agree with me and put her in a skilled nursing facility, even though it might not be the perfect situation for this couple, because that's not exactly what they want. So the interpretive model is the provider. The provider's role is to elicit the patient's values, and the deliberative model is the provider takes a slightly more assertive role, helping the patient understand their personal values in their situation. So I just combined the two to apply it to Mr. and Mrs. Lamb's situation. And as a provider in this situation, I would sympathize a lot more than I would with the paternalistic model with them and make them feel as if their opinions are heard, and I'm concerned and put them into consideration, like when telling them the best way to go about caring for Mrs. Lamb. And I would come up with more options than just giving them one of putting her in a skilled nursing facility, and give them like pamphlets of different places they could go and live together so that Mr. Lamb could still play a role in taking care of her and they can still live together, just wouldn't be in their home, which may still be an option. So I could also give them ideas of having a nurse come be with them like during the day or something, just to like give them multiple options so that they can be as happy as possible and like feel as normal as possible, because that's very important too for older adults, to live as long as they possibly can. So that is how that would work.